All right. Hello, everybody, and welcome. I'm sure we still have a few more people joining us, but it's time for us to get started. My name is Christy Shea, and I'm a senior manager here at athenaHealth, and I have worked with athenaPractice customers since 2009, and some of you even here today in the meeting. And I want to welcome everybody for joining us today for our education session. Today, all of you joining our virtual session are an athenaPractice customer, and you're all here because you'd like to learn a little bit more about the world of athenaOne. And some of you are at different phases of the journey, and if you will, and some of you have just started, some of you are further down the road, and some of you are ready to make that transition. We're going to walk you through the agenda in just a moment, but first, the first thing I want to do is, again, welcome you and thank you for taking your valuable time to be with us today. But more importantly, I would like to personally thank you for being a customer. You've all been customers for a number of years, and we really appreciate that. And as you look at this potential move, we want you to know the most important thing for us is we want to help you through this journey. But most importantly, we'd like to remain your partner, whether it's on athenaPractice or whether you make the decision to move to athenaOne. So thank you. And here's what we will cover today. I think we go back a slide. Yep. And here's what we're going to cover today. I will kick things off by setting the athenaOne table, if you will. And then we're going to get really into the heart of the matter. What I think most of you are here for is to hear from some of our customers. So I'll turn things over to Richard Adams, who is our Executive Director of Customer Success. And he will be speaking with Tina Kelly, Director of Operations from Mountain View Medical in Oregon, and Amy Roberts, Director of Health Information Systems and IT from Raleigh Neurology Associates in North Carolina. They are both athenaOne customers who converted over from athenaPractice, and you're going to get to hear their story from them about how they made the decision, how they went through the onboarding, and what it's been like since they made the transition. And this portion is going to be about 45 minutes where you'll really get to hear from them about their experience. And if you can stay a little bit longer, we'll have a 30-minute live demonstration highlighting the key strengths of athenaOne and our latest AI capabilities. So hopefully everybody can join us for that part, but if you can't, we certainly understand. And the good news is we will be taking questions throughout. So if you have a question and you want to, just hit that Q&A button and you can post a question in there. We'll take a look at it behind the scenes and we'll try to work it into the equation when we get towards the end of the presentation. And then after the conversation piece, then again with our customers, and then you'll have another opportunity to ask some questions after the demonstration. You'll also be able to use the raise the hand feature. You can raise your hand and say that you want to have a live question, and we're going to go ahead and engage with some live questions if that's something that you would like to do. Over the next few minutes, I will walk you through some of the key reasons why athenaPractice customers made the switch to athenaOne and what you may want to consider as you evaluate whether it's the right move for you and your practice. And I have talked to a number of groups across the country and the challenges they're experiencing, which I imagine a lot of this is going to resonate with all of you. And there are sort of four big things that consistently come up for me. One thing is that if you think back to the earlier days in healthcare IT, at least most of us who can remember, all we had was a practice management system, right? Then EMRs came along, patient portals, EDI, and even meaningful use. There were all these different systems that many of us had to sort of just figure out and even decide, do I need the system? Can I afford the system? Which one should I get? How do I negotiate a contract? How do I make sure all the integration works and everything stays working together over time? And how do I afford all of this, right? It was all very overwhelming, and even trying to figure out the voodoo magic of how to make it all work. And that's the challenge that many practices experienced. And the other day, I was presenting to some of our younger sales executives, and it occurred to me that they may have never even seen an actual fax machine. And I thought of that because, as you know, fax machines are still alive and well in healthcare, right? And so to that point of manual work is still a huge burden on your staff and your providers, and all the things that they have to do, whether it's managing the fax machine or having to get results into the record where it needs to go. All these things get in the way of the things they really want to do and what really they want to accomplish as an organization, providing great care and growing your practice. And to that point, We've been talking the longest time about burnout and staff burnout in particular from a lot of the things that we just talked about, all the work that they have to do for the practice just to operate. And let's be clear, medical providers really don't like their EMRs, right? It gets in the way of all that one-on-one conversation with their patients, which is what they really want to do. Between that and all the work they have to do with on their personal time, it contributes to a lot of burnout for providers and staff. And then lastly, you're getting squeezed in three different directions, right? You're getting that continued downward pressure on reimbursement, you're getting that upward pressure on cost, and it's really a bad math equation when they're all going towards each other. And then there's this COVID hangover with staffing, where many of you are still struggling to hire and retain really good staff. And so it's all these four things that we all hear about throughout healthcare and across the country. There are things that athenaOne can really address. So let's talk about those. Next slide. So the beauty of athenaOne is that we are a single system. Now, I'm not trying to say that we're everything you could ever possibly want, but it's the core things that you need all contained in a single system. The revenue cycle, obviously the EMR, the clinical experience, and then all the patient engagement, right? All the single functions are developed in a single system. And oh, by the way, it's a SaaS-based platform. And when we say that, it's a term that really gets misused, same as cloud-based gets misused. And in fact, I often think that when new technologies come along, some vendors become what I call buzzword compliant, right? Their products don't necessarily change, but they're using the new terminology. Well, the good thing is with athenaOne is truly a single instance multi-tenant platform where everybody is on the same instance of software. You don't have to worry about upgrades, which I know you all have to today, or if you're on the current version, which you have to think about every fall. And the nice thing is you're always on the current version with athenaOne. There's a huge advantage to that and the fact that all three of these components are all within one system. And by now, next slide, Nikki. And by now, you're probably all thinking, when is she going to mention AI? Well, AI most certainly is part of every technology presentation you've seen in the last 6 months. Well, the great news is with Athena, it's what we've been doing all along. We've been doing it, quite frankly, for over a decade. The whole piece I was talking about with document management and the fax machine, we've been leveraging AI to completely own the document management process for years. At athenaHealth, our strategic initiative in AI across athenaOne platforms are designed to support our customers' diverse needs, particularly in revenue cycle management, clinical experience, and patient engagement. By integrating advanced AI technologies, we are able to drive greater efficiencies and reduce the workload for clinicians and practice staff. And this not only streamlines operations, but it also enhances revenue by automating those administrative tasks and operationalizing billing processes, allowing practices to focus more on patient care. We are evaluating and deploying AI capabilities that can enhance the quality and speed of information outputs, which supports better decision-making for clinicians and practice staff. We accurately and with accurate and timely data at our fingertips, healthcare providers can make informed choices that can lead to improved patient outcomes. By reducing administrative burdens and providing intuitive tools, we can create more advanced, streamlined workflows that can foster better communication and engagement throughout the patient journey, enhancing the experience for clinicians, practice staff, and patients alike. And ultimately, athenaHealth's commitment to leveraging AI across athenaOne will support practices to enhance their operational efficiency, improve care quality, and drive better performance. And as we continue to innovate expand on our AI capabilities, we remain focused on delivering solutions that meet the evolving needs of our customers and patients they serve. And the last thing for me, before I turn things over to Richard, is again, I want to thank everybody for being a customer. And because you're a customer, we put together an athenaPractice specific program. I am personally focused on supporting and educating customers like yourselves on the incentives afforded to you as a customer if you choose to make that transition over to athenaOne. Our goal is to make this as easy as possible for your practice to convert. So first of all, we provide sub-market pricing only available to you as an existing customer. Secondly, we do everything we can to lower those transition costs. And we know that no matter what, whether it's the check you're writing potentially for certain things in the transition, or the fact that you may have to reduce staff for a little bit during that, or just generally all the work that goes into moving to a new system, we know that there are some costs involved. So we do everything we can to sort of reduce those costs of transition to make it as simple as possible for you to make the move over to athenaOne. And because athenaPractice is our solution, we know it very well and how the data is structured. We've gotten really, really good at efficiently and effectively moving the data, in addition to the onboarding of customers over to athenaOne.